Clinical treatments for depression. That's going to be our next topic, and this is going to be in two different presentations. So this is going to be part one of a two-part presentation. In this presentation, I'll explore different treatment types for depression. This is not meant to be an exhaustive study or an in-depth description of all treatment modalities, but just a brief overview of some of the interventions available. It is up to you to ask your clinician what type of treatment is best for you. Also, if one treatment type or therapist does not give you the results you seek, try a different modality and/or therapist. The first type of intervention for depression that I want to speak on is motivational interviewing. There have been studies that have shown that patients with clinical depression who went through psychotherapy that focused on motivational interviewing, or MI, and behavior activation responded better to treatment than those who went through therapy that was focused on cognitive behavior interventions and used pharmacologic treatments. Because MI, or motivational interviewing, focuses on behavior activation and motivation, it is a viable intervention to add as part of your traditional psychotherapy, and is very promising and effective intervention with depressed patients. Another type of intervention is called mindfulness. The concept of mindfulness involves choosing to live in the present moment with an attitude of acceptance of whatever is happening. Mindfulness originally started as a Buddhist practice, but is being incorporated into many different medical and psychological therapies today after researchers have discovered some of the many health benefits of mindfulness. Mindfulness has been shown to have a positive impact on mental health, including depression, substance abuse, addiction, anxiety, and obsessive-compulsive disorders. It can also benefit physical health and has been shown to lower blood pressure, relieve stress, and reduce chronic pain. Mindfulness is a form of meditation in which the person practicing it uses techniques to focus on what is happening within himself or herself at the present moment. It may involve focusing on body sensations, emotions, or sensory input, what is happening, recognizing them for what they are, and accepting them without judgment or self-judgment. People who practice mindfulness regularly can learn techniques and use them on their own, or they may continuously practice them within groups or with others. Mindfulness also may be incorporated into motivational interviewing. And pairing these two methods together has shown promise for healing in some areas. The Center for Mindfulness in Corrections uses mindfulness to promote research, evidence-based practices, improved environments, and self-well-being. The center has also used mindfulness techniques with police officers and prison guards to help them manage the stress of their jobs and to better handle the strain and difficulties associated with working in corrections. The mindfulness techniques have helped workers to relieve some of the stress of their daily jobs and to cultivating a more positive response to certain situations instead of acting out of anger or reacting in a stressful manner.